Your Excellency, Professor Ong Patin, Your Excellency, Dr. Al-Kuwari, Honorable Ministers, Excellencies, dear colleagues and friends. Let me begin by thanking Professor Ong Patin and Dr. Al-Kuwari for their leadership of this historical special session. Merci beaucoup. Shukran jazilan. I also thank all colleagues here at headquarters who have worked incredibly hard for months to organize this meeting and to make it as successful and safe as possible. But most of all, I thank you, our member states. After all, this is your WHO. I thank you for the overwhelming support expressed by member states for the need for a new accord on pandemic preparedness and response. I welcome the decision you have adopted today to establish an intergovernmental negotiating body to draft and negotiate a WHO convention, agreement, or other international instrument on pandemic prevention, preparedness, and response, with a view to adoption under Article 19 or under other provisions of the WHO Constitution as may be deemed appropriate by the intergovernmental negotiating body. I welcome your commitment to an inclusive, transparent, and efficient process led by member states and based on consensus. I welcome your commitment to hold the first meeting of the IMB no later than the 1st of March 2022, and to submit its outcome for consideration to the World Health Assembly in 2024. And I give you my commitment that the Secretariat will support this process. The adoption of this decision is cause for celebration and cause for hope that we all need. Of course, there is still a long road ahead. There are still differences of opinion about what a new accord could or should contain. But you have proven to each other and the world that differences can be overcome and common ground can be found. As many member states have said, the international health regulations remain an essential governance tool for the prevention, preparedness, detection, and response to public health emergencies. We continue to urge all member states to implement and abide by the provisions of the IHR. At the same time, the pandemic has exposed shortcomings in the application and implementation of the IHR that I believe are best addressed with a convention, agreement, or other international instrument. And as we work together to strengthen the architecture of global health security, I urge all member states to confront the inescapable truth that we cannot do that without strengthening WHO. In 2 weeks' time, the working group on sustainable financing will reconvene as it prepares to deliver its final report to the Executive Board and next year's World Health Assembly. The report includes recommendations that will improve WHO's effectiveness, financial governance, and impact. As Chancellor Merkel outlined in her remarks on Monday, increased assessed contributions to 50% of the base program budget will be a game changer. I urge all member states to support the proposals of the working group's report. Even as we look to the future, we must remain focused on the present. I have one simple request for all member states, and that is end this pandemic. As we mark World AIDS Day, we're reminded that more than 40 years into the global AIDS epidemic, we still have no vaccine and no cure for this disease. 2 years into the COVID-19 pandemic, we have not one, but many vaccines and many other effective tools. Just in the past week, this virus has demonstrated that it will not simply disappear. How many more lives and livelihoods it takes is up to us. Ending the pandemic is not a matter of chance. It is a matter of choice. I call on all member states to choose to achieve our targets of vaccinating 40% of the population of every country by the end of this year and 70% by middle next year. I call on those countries that have already reached 70% to choose to swap your vaccine delivery schedules with COVAX and AVAT, as Switzerland has just done. I call on all member states to choose to remove every barrier to scaling up vaccine production by sharing technology and know-how and by supporting a waiver of intellectual property rights. I call on those countries that have promised to donate vaccines to choose to make good on those promises as urgently as possible. I call on member states to choose to fully fund the ACT Accelerator, which needs $23.4 billion over the next 12 months to get tests, treatments, and vaccines to where they're needed most. I call on every member state to choose a comprehensive, tailored, layered combination of proven public health and social measures to reduce transmission, reduce the pressure on your health system, and save lives. I call on all member states to focus on strengthening and optimizing clinical pathways from primary to intensive care, ensuring the right patient get the right care at the right time, and that health workers are supported and protected while doing their life-saving work. I call on all member states to intensify and target risk communication, strengthen community engagement, empowerment, and support, addressing community concerns, combating misinformation, and building trust. I call on every member state to choose to increase surveillance, testing, sequencing, and reporting, and to refrain from penalizing countries that do in compliance with the international health regulations. And I call on all member states to choose to commit strengthening your WHO, especially by supporting the proposals of the Working Group on Sustainable Financing. We're one humanity. We have one planet. We have one health. And we have one WHO, your WHO. And I know you're committed to strengthen it, to have a better preparedness for the future. I thank you so much. Thank you.